Hi, everyone. Thank you for joining us for today's webinar, Enhancing Ovarian Function with Acupuncture and TCM. My name is Robin Pearson. I'm the Senior Brand Manager at L.A.C. OMS. Our webinar presenter, Dr. Beck Hoehn, is a Los Angeles-based board-certified acupuncturist who treats pain, digestive disorders, stress, and hormonal imbalances and specializes in supporting women's wellness and fertility. Dr. Hoehn received a master's degree with honors from the Emperor's College of Oriental Medicine and her doctorate in fertility acupuncture from the Pacific College of Health Sciences. She is board certified both nationally and in the state of California. In addition, Dr. Hoehn is also an active member of the American Board of Oriental Reproductive Medicine, where she pursued additional specialized training in reproductive health and fertility acupuncture and holds the distinction of being a fellow of FABORM. Before we get to the presentation, let's just take a moment to acclimate to the webinar room. To the bottom right of the screen, you'll see three tabs: questions, chat, and polls. To connect with other attendees or notify us of any difficulties, please use the chat tab. At the end of the presentation, we'll use the chat tab to post a promo code specific to this event. If you have any questions for Dr. Hoehn, please use the questions tab. Your questions will be answered at the end of the lecture during our Q&A session. We added a question to the polls tab and we'll be adding a second one during the webinar. Be sure to add your responses to both. Please note that each webinar is recorded, and immediately following the conclusion, you'll receive a link to view the video on demand, a copy of the slides, and the promo code to use on your next order at L.A.C. OMS. So without further ado, I'll pass it over to Dr. Beck Hoehn.
Thank you, Robin. That was a lovely introduction. I have to say already right off the bat, I'm having a blast with you guys, and I'm really honored to be here and being part of this community. So thank you so much. We're going to get started here on a couple of slides, and then, as Robin had mentioned so nicely, we're going to end with some Q&A. There's a couple of polls also that I would love some feedback on from you guys. So just be clear, just make sure that you can access the polls as we move through Livestorm today. So this is what we're going to be talking about. So enhancing ovarian function with acupuncture and TCM. And albeit Robin so nicely introduced me, I just wanted to talk a little bit about myself again. I'm Dr. Hoehn. I have a clinical practice in Los Angeles, California, named Mighty River Wellness. I also teach on the college level, which is lovely. And I get to be a medical advisor at UVA, which is one of the leading pieces of femtech. And as you can see in the center, I love trail running. I run every morning with my amazing dog, Clyde. There's a test on that. So a couple of stats here, just kind of moving forward into the declining egg quality and aging piece. And this is actually really interesting. As we know, the number of oocytes decrease significantly after age 30, and there is an accelerated decline between around 35, and by age 40, that viable number drops to about 50%, and so that's where most women experience difficulties with conception. The next piece here is that approximately 70 to 80% of oocytes from women aged 40 and above are aneuploidy. And this causes a significant risk in miscarriages and chromosomal abnormalities in embryos. As a result, also, we see a lot more miscarriages elevated over the age of 35, and this is also correlated to poor egg quality. A lot of times when we see those chromosomal abnormalities, that can lead to those miscarriages. There's actually a really cool study that there was a Pew Research study on this, which is there's a global research study on egg quality and reproductive aging. So this was really a really interesting study for me, because when we think about family building and starting a family, this is done globally at a really advanced age now. So this is a lot of different changes in what we identify as the family unit. And also just by nature of people are starting their families later because they're more career-based and more career-oriented. It was cool in this study. Also, over 61% of the data reflected that most people had bachelor's degrees that were starting their families. And I thought that was really interesting. That was from 2015 on. So that decline was, or that increase in people getting higher education and pursuing their professions first. And as a result, we're seeing this contribute to infertility worldwide as well. So this is our cool poll time. I don't know if we're going to get the poll up here or not, but I'm just kind of curious, just to start right off the bat, for those reproductive acupuncturists out there, what is the average age of your fertility patients? So I did the fencing here on the ages based on, this is just a traditional marketing fencing for targeting. And this is just how we collect our data at the clinic as well. So we just kind of put patients in these demographic buckets, and then we evaluate the data per quarter. I'm just actually curious what the feedback here is from the reproductive health people in the room. So I'd love to talk about that at the end of the discussion today. So these are some things we're going to hone in on as we kind of jam through this webinar. And we're going to talk about egg quality and fertility, particularly the mitochondrial's role in oocyte development, and also some evidence-based treatments for improving ovarian health, and then some strategies that you guys can execute on. Now, remember, when we think about high-quality eggs, we're thinking about how that improves implantation and pregnancy rates overall, right? So embryos with higher quality eggs exhibit significantly higher implantation rates, which translates to better pregnancy outcomes overall. So we think about Dr. Joe Pizzorno's work here. He's got lovely, lovely data on this, which we'll link to in the citations at the end. And he really talks about just post-war, World War II, and that bioaccumulation and generational toxic load. So this was a really great pivotal time in the Dow. The Dow company started a marketing strategy called Better Living Through Chemistry. And we saw a rise in a ton of industrial chemicals, pesticides, and synthetic materials, which were really emerged as something and which still persist in the environment today. So we saw a lot more PCBs, dioxins, heavy metals, and endocrine disrupting chemicals as a result. So I think the data shows that there are 22 known toxicants in a fetus's liver that are passed on from that time, which is really interesting to me. So as a result, we're seeing a really a decline in reproductive health overall, and it's related to that toxic exposure. We're also seeing an exacerbated decline in birth rates overall. So this can also be attributed directly to the burden of inherited toxic exposure as well. But there is hope for improvement, and he talks about this in this lecture as well, where we can make choices and guide our patients better to make choices that are within their control and not stress or focus or obsess about the things that are not in their control, right? So I always use CVS here, Cashier Very Slow, as an example, because if anyone is on the East Coast, you know that when you go to CVS, you get that really, really long receipt that is almost like, it's like a scarf that you could wear in the wintertime. But that's covered, and that thermal paper is covered in bisphenol A, right? So you're really not going to use that coupon that's on the back. It's going to expire in 3 hours anyway. How about just have that receipt emailed to you or not touch it at all? So that's a way, just as a tiny little hack, where you could really mitigate your exposure. So we're going to talk a little bit about the importance of egg quality and a couple of ways that overall, we're going to talk about the first three ways are we're going to improve blood flow to the follicles, optimize mitochondrial function, and reduce inflammatory response within the follicular environment. So the first piece here is all about blood flow, right? Because if we have increased nutrient delivery and the removal of toxins, that is going to give rise to better egg maturation overall. So when we think about enhanced supply, we're thinking about increased blood flow to the ovaries. It really can deliver a greater amount or abundance of essential nutrients and oxygen really necessary for the growth and development of follicles. We're also considering optimal follicular development here. When we have that adequate nutrient and oxygen levels, we can ensure that those follicles can really develop to their full potential. And this can really foster the maturation of healthier eggs. And finally, we want to talk about hormonal function, right? Because when we have that really consistent blood supply, we're able to effectively deliver hormones such as estrogen and progesterone, which are really critical for follicular growth and ovulation. And on the other side of the coin, we want to consider toxic clearance, right? Because we have all those byproducts of metabolism. And so that enhanced in circulation can help in the efficient removal of toxins and metabolic byproducts that could otherwise really accumulate and damage the cells within the ovary, including the eggs. We also want to really consider oxidative stress when we are thinking about follicular development and that follicular environment, because better blood flow can help reduce that oxidative stress by flushing out those free radicals and protecting the DNA and the cellular structures of the developing eggs. And finally, it's life in balance, right? We want to maintain that cellular homeostasis, and efficient removal of these excess hormones and other cellular debris really help maintain a balanced internal environment conducive to egg maturation. And again, just kind of segueing into this a little bit more is we think about improving hormonal signaling overall, because that blood flow can really ensure consistent and effective hormonal signaling between the brain and the ovaries. This is really crucial for timing and development around ovulation. And we can sync up the menstrual cycle with a little bit more alacrity here. Regular blood flow can really sync up the menstrual cycle, which is important for releasing that timing and releasing that mature egg. And remember, the endocrine system doesn't like surprises, right? So we're able to create stability in the endocrine system. This is really important because when we have a really stable endocrine environment, we can ensure that the ovaries really respond properly to hormonal cues. So moving on to the next piece is the mitochondrial function. These are the powerhouses of the cell and where we produce ATP, right? And this ATP is really crucial for oocyte maturation and embryo development. Remember when the DNA spindle fibers unpack, and they're stored and packed within the cell system. And then when there's fertilization happens, those spindle fibers unpack, right? And then they join together. The way that they unpack and how efficient that is really dependent on how much energy the cell has. This was a huge deal for me to think about because I think about blood flow all day long, right? I'm an acupuncturist, but when I started thinking about the other piece of the coin, I was like, yes, of course this makes sense, right? It takes a massive amount of energy for fertilization to occur. That's a powerful sentiment that really started driving my treatments in a different way. It seems obvious now, but at the time I had never thought about it. And so when we have better mitochondrial health overall, we're reducing that oxidative stress. We're ensuring cellular longevity. And overall, this can really increase our live birth rates, right? So there's some really interesting papers on mitochondrial function and reducing oxidative stress. There was one study that indicated that if there is dysfunction in the mitochondria, that leads to lower fertilization rates, lower egg maturity rates, egg quality is out the window, and that can eventually endanger fertility. So remember, we want to think not only quality, but quantity when we're thinking about oocyte health and mitochondrial function. One thing that's really interesting that's happening in studies now is antioxidant activity, right? So antioxidants may improve that mitochondrial function and really benefit fertility treatments. You can also think here, not just the supplements like CoQ10, but also really starting to incorporate and teach your patients around red polyphenols can be really important here too. So the next piece is inflammatory response. Again, hot ticket item if you are an acupuncturist at all. You think about inflammation all the time. I wanted to kind of talk a little bit about the yin-yang imbalances and how that relates to inflammatory response. So in TCM, inflammation is really really viewed through this concept of yin and yang, right? We focus on this notion of excess and deficiency. And it's often seen as internal heat, which can give rise to either excess of yang or deficiency of yin. So just kind of talking about this a little bit, and then we'll talk about the other piece in a second, right? So excess inflammation or yang can occur when there's too much yang energy, and that can lead to an accumulation of internal heat. So we might see that as redness, swelling, and heat in the body. And this can also be attributed to the pathophys here, which is the stagnation and the accumulation of, which can really disrupt that flow of energy. And also it can result from a deficiency of yin, right? Because it fails to balance the yang out, and it can lead to relative excess of yang and internal heat. So we kind of think about that when we think about a link to a deficiency in kidney yin that can really affect hormonal balance and ovarian function overall. When we think about excess yang, we're also thinking that it directly produces inflammation through heat and energy stagnation. And deficient yin comes into play here because it fails to counterbalance the yang. And it can lead to a similar increase in internal heat, and also have a lack of the cooling and nourishing forces. So when we think about balancing out yin and yang in terms of fertility, we really have to consider that. Even with our formula building and our point selection, we really want to balance everything out. And when we also think about inflammation, we want to think about reducing those pro-inflammatory cytokines, right? And that promotes a healthier follicular environment and also supports that egg viability. So when we have enhanced circulation, it helps to remove those pro-inflammatory products more efficiently and reduce inflammatory products overall within that ovarian environment. And this can also relate to result in a prevention of follicular damage, right? Because if we don't have as much inflammation, the risk of damage to the developing follicles is lowered, right? So it promotes healthy and viable eggs. We're going to stop here for a second on this slide and talk about Reese's Peanut Butter Cups because there's not much. I like running. I like my dog. But there's not much more in the candy industry that I like more than Reese's Peanut Butter Cups. And you really think about Reese's Peanut Butter Cups and how they really relate to the yin and yang of the candy industry here. In all kidding aside, this is a perfect example of two things that are really great on their own. When they come together, they make something extraordinary, right? And moving forward to the second half of this discussion, I'd like to talk about some Reese's Peanut Butter Cups that are related to TCM, because I think that it's really interesting to think about these Dui-Yao pairs. Remember that we think about that herbal, that complementary synergy when we're building point selections, when we're building our formulas. When you don't know where to start, you can always start with some of these really simple dueyaos. This can really combine, this combination kind of therapy can really enhance those therapeutic effects and reduce those side effects, right? So this really aligns with this notion of balancing yin and yang. And it really provides also a lot of flexibility when you're trying to tailor a treatment. When you don't know where to start, I always start with a dueyao. Well, okay, I have these two things that I really need to accomplish. What point can I cull from that will do that? And what other point can I use to put those pairs together? So if we were talking about some herbal pairs, we could do some turmeric here with some gansao or licorice. And this can work really synergistically together to reduce inflammation and manage oxidative stress. So that can, in turn, that just like one little pair can really improve ovarian circulation and follicular development. Conversely, or actually on the other side of the salt to the pepper here, we can talk about stomach 29, right? Because stomach 29 is epic for blood flow to the pelvis. And then we can use our darling here, Ren 6, because that regulates chi and blood for ovarian health. A lot of different combinations that we can talk about here. We're going to talk about some key differential patterns. Again, this slide could have been 20 yards long, right? Everyone's got a feeling about differential here. But we're going to stick with some of the guardrails of these three, right? So we're going to talk about a couple of kidney deficiencies, some liver qi stagnation, and round it off with our favorite blood stasis. So remember, the treatment principle here would be to support kidney yin for kidney yin deficiency, clear deficient heat, and support the essence, right? So you can start incorporating foods like black beans and walnuts to really support that reproductive health overall. And think about tonifying the kidneys and promoting that blood circulation. This is really good for a cornerstone of your treatment when you're thinking about reproductive issues, right? The Dui Yao here would be Zhermu and Huang Bai, right? This is a classic Dui Yao combination. It's used to treat kidney yin deficiency with heat signs. The Zhermu can nourish the yin and clear the heat, and the Huang Bai can come in and clear deficient heat, especially from the kidneys, right? And it can help cool the body and alleviate those symptoms. You'll see those a lot together. And the modern research dictates that Zhermu has been known for its anti-inflammatory action and its nourishing effects on yin. And conversely, Huangbai, believe it or not, has a strong antimicrobial, anti-inflammatory effect. So it's got some heat clearing properties in it as well. It also targets the lower jiao, right? So it can cool and clear heat from the body. This is my favorite to talk about. So warming and tonifying kidney yang, I see, believe it or not, albeit I'm LA based, I see this one a lot in reproductive health. People come in really cold, right? You see it all the time. And really warming that Mingmen fire is going to be an essential treatment principle for you. The Dui-Yao pair here is really interesting when we think about cinnamon and aconite, roquei and futsa for yang deficiency. You can do this a couple of ways, right? You could put some futsa on a piece of ginger, on the umbilicus itself. You could smelt the umbilicus, pack that with herbs, and then put the ginger with a couple of holes on it with some futsa. And kind of do a rescue yang situation with some moxa over it if you needed to. We use a lot of moxa in our practice. I'd love to hear from the group as well. We have a training video and then an ebook on it. It's pretty interactive, but it's a really great way to help get that peripheral vascularization to the follicular environment. The flavonoid activity is pretty effective for that, which is in mugwort itself. And people really love it. They love to be empowered. They love to be engaged. They like to have a little bit of homework. I don't know, at least in my office, they do. So we're really considering what roquefort does, cinnamon, as we know from the guajir, is really great for insulin resistance, but roquefort also has this warming effect. And so it can really be helpful for improving circulation and relieving pain. The aconite here is great. It's got a great thermogenic effect. It's a very warming herb overall. It's good for restoring warmth and yang deficiency conditions. And you can also think about morindia. I just started growing this actually, thinking about it for tonifying the kidney yang and also using it for that lower back weakness and reproductive health. And then the horny goatweed as well. Yin Yang Ho is a great herb overall. Tonifies kidney yang, can really boost libido. We use this in concert with antidepressants a lot when women have not a lot of libido. It can also enhance qi. And then you can use some female ginseng here as well, some dongquai, albeit it's not in the yang category. It can be tonifying blood, can be a great treatment strategy as well. And then you can, again, I talked about moxa already, but I really like to teach people to do moxa around Ren 4, and then also moxa on stomach 36. And then also I do moxa on child's palace as well. So just all along that top of the pubis kind of area. Again, we have some really good results by people using moxa, particularly during egg retrievals. So we usually have them do that pretty much daily. So I live in Los Angeles, which is the, I feel like where this pattern was created, actually, liver qi stagnation. We have people come in, if they say, define your stress from a 1 to a 10. We have a patient base that's probably at a 25, just kind of walking out the door, getting tacos, 25, pretty high. So I do a lot of digestive health support as well, just with before even talking about making a baby, because we have that liver overacting on spleen differential all the time, right? So we need to get them mitigating their inflammatory response in their gut, in their center, before we can, and get them relaxing their nervous system before we can even get them to start making a baby sometimes. There's a great pair here, Chai Hu and Bai Xiao, of course, to soothe the liver and relieve stagnation. Just classic formula start. And then also I talk a lot about using bitter greens to stimulate liver function, right? So we train people on using things like rainbow chard, sorrel, can be really helpful, dandelion, and that bitterness can really start stimulating liver function pretty efficiently in people. I actually start people out with like a ton of high fiber in the beginning couple of weeks when I start working with them, and it really makes a difference. Another thing that we do at my office is I generally will record a customized kind of sleep affirmation or fertility affirmation for them to regulate their nervous system. And we have people do that in the early stages of working with them for about 2 to 3 weeks, just kind of listening to that every night so that they have something, another tool besides maybe their medication or whatever system they're working. Maybe they're working with an EFT tapper at that point, to just learn what dysregulation looks like in the nervous system and what regulation looks like. This can be really helpful. So rounding it off here with our buddy blood stasis. So blood stasis is really common in fertility and reproductive acupuncture. It can arise from a couple of things, right? So emotional stress can impede that liver qi. Trauma can be an issue, cold invasion, chronic illness. And this can overall, these kind of things can really weaken that circulation of blood, right? And so over time, that can lead to poor circulation in the lower jiao. So when we think about peach kernel and safflower here, taurin, honghua, These are really essential for blood circulation. So again, also if you see that it's more of a cold stasis, you can again go back to your moxibustion here. It's so lovely. It gives the patient something that they think that they have control over, and that they feel like they're being proactive in their health. I think that that's really important. So when we talk about modern research and we talk about taurin, we know that it can improve that circulation overall. It's got some great anticoagulant and anti-inflammatory properties. It can really make it effective for poor circulation, poor blood flow. And when we think about Honghua, we know that it's really great for reducing inflammatory response, and it can also prevent platelet aggregation. So those two together can be a really great place to start, particularly if you have somebody with a dysregulated menstrual cycle, they've got some dysmenorrhea happening, or even abdominal masses. Obviously, you would add other herbs to dispel stasis, right? So like Iju, Songlen, things like that. Some other really interesting herbs to kind of consider here would be Chirshao, which can invigorate the blood and dispel stasis and also be really cooling overall. And then my favorite mother herb, man, Yimutsao. I use this all the time. I love it. It can really be widely used for moving blood, regulating menstruation, and resolving masses. It does a lot of functions. It's a really unsung hero, I think. In terms of acupuncture points, we want to start thinking about three-leg yin here. So spleen 6, liver 3 can be a great choice. And of course, our influential point of blood, bladder 17, always a good one. So some of the things that we can think about here in terms of acupuncture treatment strategies as well is some Dui Yaos as well, right? So again, we talked about stomach 29, improving pelvic blood flow. Powerful, huge point. And then pair it with Ren 6 to regulate qi and blood for ovarian health. Another really interesting study was just done. Well, they're very studied actually. Is the 4 gates overall, and using the gates to for stress reduction, regulating the autonomic nervous system, and reducing oxidative stress. So it was really interesting. The study was about points that can regulate that HPOA axis and benefit overall ovarian health overall. So really interesting. There was part of this study was they did this study on people that were undergoing IVF, a pretty good sample size too. And they found that there was a distinct reduction in stress-induced cortisol levels and improved pregnancy rates by enhancing, using these points to enhance reproductive function. Very interesting. So I wanted to talk a little bit about TENS unit acupuncture and how I use it in my clinic. It's just one way. So usually in office, and this is just kind of general practice for reproductive acupuncturists, but leading up to the retrieval, I'll have the person come in at a treatment cadence of around twice a week leading up to the retrieval. We also use this procedure for beginning phases of natural conception as well, just to kind of get the person moving forward in that engagement and that education around why they should start kind of making this part of their fertility practice and their fertility health. We use Steiner-Victorin points, and we can actually, I also send people home with just a little TENS unit from my community library. We have about 20 machines. And so we'll have the patient sign that machine out, and then we provide extra pads for them so that they can do the TENS unit at home. It's not the same as needling, obviously, but we find it just as effective. And we do those on those Steiner-Victorin points, right? So we teach them the points on the lower jiao, the lower abdomen, and then those points that relate to the femoral artery, UB57, and spleen 6 on the lower leg. So there was actually a study done on this, and they did TENS unit acupuncture every day. And as a result, those people, that population had better clinical pregnancies, better implantation, improved live birth rates overall. So this can be a really great adjunct therapy or intervention for IVF as well. So usually in most of the studies that I looked at, the TENS, I figured somebody was going to ask me this, so I looked it up. So usually it's like a low frequency stimulation, right? Around 2 hertz, and the sessions last around 30 minutes. So in the studies, the treatments were administered daily or several times a week over the course of several weeks, around 8. And I was like, when I saw that correlation, I was like, oh my God, there's nobody that is in this group that has somebody come in every day for acupuncture. I mean, I don't know. Maybe there is. So you can please correct me if I'm totally wrong but like I couldn't imagine coming in for a year every day to acupuncture. Just that would be exhausting as a patient too, right? Which reinforces my use case here of the little tiny TENS unit machines, right? So if they're doing it at home, I find it to be as effective. When we started signing out those TENS unit machines from the community library, our success rates went up considerably. So I want to switch gears here a little bit. We've been talking about clinical practice a lot and just kind of the nuts and bolts of clinical practice. But I wanted to just kind of summarize here on these next couple of slides around a couple of ways that we can start as a group and a community, start managing patient care differently, right? So when we go to school and we go to the master's level, we're taught that every patient is like a snowflake and it's very special. And I'm not undermining or marginalizing that that's the way that the care should be. I just ask or challenge you to be a little bit more organized around your systems, your operations, your KPIs, your key performance indicators, and creating that system. When there's a system, there's better leadership and there's a better chance that you're able to be anticipatory with a patient. When you're able to anticipate patient milestones, you establish know-like trust with your patient. If you're able to see where their milestones or where their challenges are going to be, and the road rises up to meet that patient at that particular intersection, and you're the guy that delivers that information, you create not only engagement, but you can be really transformational. When I started organizing my data and my patient experience around this model, I felt more confident. And also systems and operations were able to really run without me, which I think is really the sign of me being a better clinician and a better business owner, right? If I don't have to be in the room, then if I've automated, I've done a pretty good job. But this is just my own personal feeling about clinic management. So this could be what it looked like for you guys, right? This is just, please use this as a model, right? Because you can make this fancy brand colors, you can use this graphic, but I encourage you, and I'm happy to help you with this. I want you to have a 3-part proprietary process by which you improve ovarian health. You can do the same thing for sperm health. You can do the same thing for PCOS management. But to try to create this system, you're able to move through these patient lives with a little bit more ease, a little bit more alacrity, and the patient process becomes less challenging for you, right? So in this first piece where we see that kind of like light petal color and it says gather, this is the part in my system. I spend about 2 to 3 weeks of treatment once a week, talking, engaging, moving through very specific guardrails around the subject matter of what gather means. with a patient. And so this is kind of like my tier 1 with a patient. So I'm doing the gather system here. It can look different for every person. But in gather, what I'm doing is I'm maybe sending them home with a toxic load assessment. Maybe I'm asking them to do a list or an inventory of things that they have in their pantry. Thinking about a stress management scale here would be really helpful. And kind of taking all of those pieces of our medicine and taking them down into these tiny little outer foils, which we call these smaller little sections here on the outside. And these are called accelerators, right? So these accelerators are how your patient flow is going to move from one kind of category into another. And they should, if you were to take these outer foils, one kind of works together with the other one. So it's a really smooth system that you start working with. In Teach, which is that kind of lovely peach color up there, or flesh color, you're starting to really thinking about amassing what you've learned in Gather, and then kind of teaching the reasons why there may be roadblocks for this patient, or the reasons why, the motivation for why you are doing the treatment principle that you're doing, the treatment plan. And maybe I give people a syllabus at this section. Like, this is what we are going to do on treatment 4. This is what we're going to do on treatment 5. And then we plan out and book their appointments. We create their telehealth pieces at this point. In my practice, there is a lot of, I do a lot of just consults. I'll jump on a patient call with somebody if they need it. And these are all scheduled during Teach, right? So I do about 3 of these during Teach with the partner. And so we're like, okay, guys, this is what we're going to do for meal planning. This is what we're going to do for toxic load. This is what we're going to do for mindfulness. So they each have, like, these are the kind of, we're having meetings around, like, status meetings around what they're going to do to execute in those 3 weeks. By the time they get to ACT, they have flown the nest, right? So with the exception of their acupuncture treatments, there should be no conversations at all in office, right? So you can reduce the talking time a little bit here, and the patient engagement, because you've educated and you've gathered so much. So you've created this system on the back end that sets you up for success with this patient. There's only a little bit of adjustment and tweaks, in my experience, that happens in this kind of sector. And remember to use this model and to use an iPad and teach them about what they're going to do during their expectation and their patient care with you, and draw a heart in the center, because the heart creates connection, it creates engagement, and it creates excitement around their fertility journey. Whereas before, they're just kind of taking pills and shuffling through life. I wanted to talk a little bit about this case study. This is great. We took this woman through that tile. She was actually one of the first people that we used that model on. And this patient was 40. She had started IVF in 2020. And if you know Los Angeles at all, you know it's a massive city, but she was at one end of the city and she was driving 2.5 hours before she got to work to have her blood drawn for IVF treatments. So she was like, her clinic was 2 hours away from her home, which is nuts to me. She went through 8 rounds of retrievals and didn't have one viable embryo. Like, amazing. And when she started the process, most people ask about her baseline cycle day 3 labs. Those were all within range when she started. So there shouldn't have been any reason that this patient should not have been able to get a viable embryo. Whoever is raising their hand right now, which I'm sure there is somebody that's talking about DNA fragmentation and sperm health, sperm parameters were fine, right? This talk's not about sperm parameters, but the sperm parameters were fine on a test. But it was really interesting. The management of this case she also came to me, and this was a really more of like an observational piece for me and experience is she came with a load, like almost like a wagon load of camwow herbs, right? So those cold pressed, lovely Korean herbs are so good. And I was so impressed that she found a provider that could do that. And like, but she felt like it was really tough for her to understand. She said one of the things that was marked for me was, I have this bag of herbs and I have no idea what they do. I have no understanding of what they do. And I was like, that should not, I personally feel like that should not happen. Like if you have a patient, I always do due diligence and make sure that they really understand every piece of the process, right? So we really want to make sure that we lead with that a lot. And so during the beginning gather phase for this patient, it was really interesting. I found like, okay, what makes this person tick was my thing that I had to feel like I had to get into the skin of this patient almost. And we found she was just like me, right? She liked color coding. She liked spreadsheets. And she said, oh, one of the things that drew me to your clinic was that you guys have checklists. So I was like, okay, giddy up. So we made her a series of checklists that she could add into a fertility journal. And at the time also, we started incorporating BBT charting into her fertility journal. I hadn't been working that much yet with UVA. So we weren't using a clinical dashboard, a digital dashboard yet. But she loved the fact that she was plotting her BBT chart and that she was able to write in that journal. And it was just like a way that she felt like she had a sense of control around the situation. We did a lot of counseling with the husband was a very picky eater. So we had to do a lot of motivational interviewing in terms of eating something beyond just a plain hamburger. And that came up too, right? And I can't even believe this patient is one of my favorite patients to talk about because she conceived in 3 months. And that was just a couple of tweaks, right? So it was just really spending a lot of time on discovery, really moves the needle for this patient. Excuse the pun. Did anybody get that? Okay. All right. So these are our tiny but mighty babies from this past batch. We kind of do things in cohorts, I noticed at the office. So this was our recent cohort. We called these guys the Sisterhood of the Traveling Pants because I don't know, I couldn't come up with a catchier title. These guys all conceived on the same week, actually. It was a really red letter week for the office. We send people care packages for their babies, so little gifts when they're born, and they come with these little T-shirts. And then we put the baby photo up on the wall. So we have a huge gallery of all of our little mighty babies up on the wall, and it's really cool because people come in and they're like, "Oh, my dry cleaner picture of my baby is going to be up on your wall someday." But kidding aside, it really is fun, and it actually makes for the day for us to be more fun too, because we get to see all these victories, right? So I wanted to talk a little bit about how I help people just like you. So as a result of doing a lot of webinars this year, one of the things that I really enjoyed doing is doing some mentoring sessions. And ways I can help you are a couple, right? We talk obviously about case management quite a bit in our mentoring sessions, and also how to move your clinical practice. So scaling your clinical practice. I'm way big in creating foundational support in the business sector for acupuncturists. I think it's really important. I don't think we get enough practice management on the master's degree level. And I will suggest mentoring resources that have really helped me during our sessions together. and things that I've learned through Goldman Sachs and my training there as well. So you can always schedule a session with me through my office coordinator, and we'll send you the information for that. And I really look forward to hearing about your practice. I love it. This actually gets me really jazzed. I'm really liking this new expansion into helping people. So we made this super amazing coupon code for you guys today. So please buy these products. They are amazing. This is actually where we shop for my office as well. And this coupon code, which is popped up here in the screen for you, is BH Webinar 724. And I would love for you to use that. I think we're at the end of our slides. Yeah, blue slide. Okay. Thanks, guys, for that talk today. That was amazing.
Thank you so much. So we have a little bit of time to maybe just give you the results of the polls first.
Woo! Oh, I also have a question for the group too.
Okay. You want to start with your question?
Yeah, I do actually. Thank you so much. I would say for the people in the providers in the group that are kind of working all the time, I would love to learn about what you would like to hear more about in terms of webinars. So do you need more information and content around IVF support and that process? Would you like more information around something specific like PCOS? I just did a talk on that, which is really super fun. Sperm health and management, motivational interviewing for partners and how to get that couple on board. Endometriosis would be another one to kind of really consider. And then also something like even how digestive health really correlates to fertility management. I'm just kind of curious if we could just put the answers in the chat, right, Robin?
Yeah, that's fine. Yeah, and as just if you want to just go right through the poll, we can send that information out when we.
Yeah, let's do the poll.
So the first one, what is the average age of your fertility patients? The majority at 54% said 35 to 40.
Yeah, okay.
26% said 30 to 35.
Okay.
13% said 40 to 45. And then very low numbers for 25 to 30 and one person for 45 to 50.
Yeah, 25 to 30. I mean, okay.
Yes.
Okay.
And then what categories related to reproductive acupuncture would you be interested in learning about? The majority at 33% said IVF support and the IVF process. Close second at 32%, unexplained infertility. 19 endometriosis, and 16% PCOS. So all four of them very, very close.
Very close.
Yes.
Oh, and I would love to talk about the IVF process. What? Sorry.
Perfect. And I can send you that afterwards too.
So okay. Fantastic. I was trying to track that on a spreadsheet. Okay. Cool.
Yeah, I saw you writing. We'll just do a couple questions before we close at 4:00. We'll start with the first one here. What is Dr. Hoehn's approach to chronic interstitial cystitis? Did I say that right?
Yeah, that's a really specific question. That's a, hey, how you doing? Jump on a call question. That's a lot of layers to that. That's very specific to the case, right? That's something that you would have to see the person in front of you. Chronic interstitial cystitis. Yeah. I would do a lot of herbs in the beginning of that and also try to reduce the inflammation overall, obviously. I would have to really look at how long the patient had interstitial cystitis before I started working on that. But yeah, I mean, I would also kind of look at some of the studies. I do, again, a lot of TENS unit acupuncture. So that would probably be something that I would start and lead with.
Okay. Is the mitochondrial function influenced in the IVF or ICSI process?
ICSI process. Yeah, for sure. Yeah, we see that all the time. A lot of the data is around mitochondrial function and support and optimizing that. And as part of the IVF process, and how that has increased live birth rates in IVF overall. So really interesting. Yeah.
Another question is, if a patient has an underlying condition like PCOS, do you work on that prior to treating the fertility aspect?
1,000%. Yeah, 1,000%. I just actually gave, shameless plug here, I just gave a talk last week about PCOS. It's on YouTube about this very question, which is really interesting that you asked. So yeah, for sure, we have to get the person ovulating if they are in ovulatory first. And that becomes a step-by-step process. So I have about 4 or 5 things that I'll lead with first to start managing a PCOS case. And then once I get to them to that tile and I get them ovulating again, then we start teaching them about femtech and tracking. We don't start with fertility there. No way. Also, because if they start leading with how they're tracking their cycle and what that looks like, albeit a graphic representation of their cycle is really helpful for you. They'll go bonkers. They'll go bonkers. They'll be, holy shit, I'm not ovulating. What has happening? So start with some basics first around managing PCOS. You can do it. I see it all the time. And then start working on the fertility and give yourself like 8 to 12 months on just the PCOS. And that's a treatment cadence of once a week for about a year.
Great. Thanks for sharing that. You have that on your YouTube too. That's very helpful.
Yeah, tons.
I love Moxa and would be interested in how you instruct patients to use it at home.
Oh my God, these are such good questions. Yeah. So we have a video. So I create a lot of mini courses for my patients on like little topics, right? So I'll do one, for example, I'll talk for an hour on cervical mucus and I'll put that on their patient portal website. So we have a patient portal where all of these tiny little, like it's like a course academy, and they can go and like learn all of these little classes. And so we have one on moxibustion. So they get a mini course on moxibustion, and then they get an ebook on how to do it. Some people are visual learners and some people are verbal, auditory, right? So I find having a mixture of both options and resources for people is really important. And then we have an ebook that we give to them. And this ebook has all of the instructions. And then there's a training checklist. This goes on for a long time. I'll try to be fast. There's a training checklist that the office coordinator has. And the office coordinator is trained on how to use Moxa. And they go through a training as part of their onboarding, right? So at that first patient visit, we allow an extra 10 minutes for trainings on different pieces of modalities and interventions.
Perfect. Thank you for sharing that as well.
Yeah.
What exactly is poor egg quality?
Yeah. So poor egg quality can mean a lot of things, right? Remember that it's not as much about the egg, the oocyte as much as when you shift away from that. That is actually the vernacular in the current culture. It's more about that follicular environment that we're considering, right? So remember that you are born with all the oocytes that you'll ever have. You can't make more of them. You can't change them, right? But you can change and improve that cellular integrity, the cell wall, right? And you can reduce those inflammatory products so that you have a better follicular environment. Remember, when the oocyte is developing, it's developing in a little sac, right? And so as that is what we're really thinking about when we're thinking about egg quality overall, is reducing how the improving how the oocyte develops, improving that environment for the oocyte so that it can develop properly. So we're almost giving it a better boost overall, and giving it better mitochondrial function overall. So we're kind of working with what we have.
We'll do 2 more questions. What points do you tend to like to Moxa post IUI?
Post IUI. So post IUI, I would do the ones right above the pubis, right? So just Ren 4, Ren 6, and into child's palace as well. So that's where I would start. I usually have those people post IUI come in for a treatment though, and I'll do some TENS unit acupuncture on them.
And then the last one, any comments about treatment for premature ovarian failure, treatments before and after IVF?
POI, treatments before and after. What part of the IVF cycle would they be in?
Does not say.
Does not say. Yeah, so POI. So you're working with what you have. It depends if the person's ovulating or not ovulating. Generally speaking, we think about things like reducing inflammatory response overall. So I also use things like NAC or resveratrol. Fish oil can be really helpful as well. So I'll call from that supplementation. And then also doing things like if you see deficiency cold signs, smelting the umbilicus can be really helpful. And then believe it or not, there's some cool studies on Wenjing Tong for optimizing egg quality and ovarian health overall. So kind of working with what you see in front of you at the time and just being able to modify using those duoyaos can be really important.
Well, thank you so much for getting through those questions. I know that there's a lot more here. If you want to email us at marketing@lasaoms.com, we can get some answers for you.
Yeah, for sure. I can shoot looms on some of those for people too.
Perfect. Thank you. And thank you so much, Dr. Hoehn. And thank you all for joining us for today.
We didn't talk about the skirt and the pantyhose.
Oh, funny. She shared a very funny story with us that would not be appropriate for this. But maybe next time.
Next time. This is the sequel in the sequel.
Exactly. You have to follow up to get that. So be on the lookout for an email with the promo code again, which is BHWebinar724 for 15% off site-wide and a link to view all of the slides. Thank you again for joining us, and we look forward to seeing you next time.
See you guys later.
Thank you.